Good morning everyone, how are you? Hope you all of you are doing well. I am Dr. Sandeep Tandil. I am a general and laparoscopic surgeon. As we are discussing various types of swellings in our body, similarly I have selected today a topic of a mucus cyst or mucocele. What do you mean by mucus cyst? How it occurs? What are the symptoms? What are the signs? What you expect during examination from a doctor, what investigations will be performed, and what will be the treatment and follow for that. This we will discuss in details. Along with this video, I will show you some photos so that you can understand what is a mucus cyst properly. So what is a mucus cyst first of all? Mucus cyst is a small swelling which occurs on the lower lip, inner part of your lower lip. What are the causes for that? We will discuss. So mucus cyst can occur anytime means any age. It's not related to age particularly. So the reason for the developing mucus cyst is some people preferably have habits of biting the inner lip. They might bite it simply while sitting or talking to somebody, or some people while chewing their food they might bite accidentally their inner part of the lip. Or if you are eating hard foods, like difficult to chew type of foods, that time you might bite by mistake, you might bite the inner part of the lip also. Why biting of the inner part of the lip can cause the mucus cyst? Inside our mouth there are multiple large number of the mucus glands, or you can say the salivary glands, which secrete mucus continuously in your mouth. That's why you have that moistness inside your mouth. So whenever this gland gets damaged or blocked, the block means the opening of these glands gets blocked, then the saliva won't come outside and it will get accumulated inside this glands, and then the swelling will occur on that area. So it can happen in the inner part of the lip, it can happen inside your mouth also, below the tongue, in the floor of the mouth. In any part it can happen, but most commonly it happens in the inner part of the lower lip. So we'll discuss about this condition, which is common. So what symptoms you will have when you develop a mucus cyst or mucocele? So the symptom is a simple symptom which you can see is a small swelling on the inner part of your lip, which might be small, like it might be a 2 mm, 3 mm. It can go up to 1 centimeter or 2 centimeter also, depending upon the size. The swelling, when it is smaller in size, you may not realize also there is a swelling, but as it grows you will start feeling some swelling on the inner part, which you might feel while biting or chewing food, or you might feel with your finger also that there is some swelling developed. This swelling sometimes disappears by itself spontaneously. You may not realize that there was a swelling also. Sometimes they do not go, they may persist over there, and it will trouble you. Trouble you means you will feel there is a swelling, something inside. Mostly it will not be painful. Some patients, if it is infected only, it might be painful. So when you see yourself in the mirror, you will see a small swelling on the inner part of your lower lip, which might be smaller in size or bigger in size. What color you can see on that is, it can be pinkish in color, it might be reddish in color, it might be whitish, or it might be slightly bluish tinge color over that area. When you touch the swelling, you will feel something over that area, and you will differentiate between the normal and that swelling area. What other thing you can check while any other swelling is inside your mouth or not. Some people try to squeeze it that time, and I will advise you, if it is not disappearing by itself, do not try to squeeze it. You will unnecessarily damage the inside gland further, or nearby glands also you will damage. You will squeeze it, it might rupture, and again it will come back after few days or few months. So it is advisable, do not try to prick it, or with your nails or something to break that cyst. What simple treatment which you can try at home, I will say, is you can take some salt water, in 1 glass of water add some salt. Try initially, in the initial phase, when you see a swelling like this, put some salt in 1 glass of water. Do this gargles for 30 seconds every time, for 4 to 5 times in a day. Do it for 2 to 3 days and see whether it is disappearing, it is going by itself or not. Salt water sometimes helps in shrinking in the size. It might disappear completely, but not every time it can happen. So if the swelling is not disappearing by itself, or after doing this simple home treatment, you need to remove this swelling, because it will persist over there, or it will keep on increasing in the size. So when you go to the doctor in this specialty, like a general surgeon or ENT surgeon, go and meet them, the doctor will examine you. Examining before that, doctor will like to ask a few questions. So what you can expect from the doctor to ask? The doctor will ask you, since when you got the swelling. He will ask you like it happened in one day, or it happened over the 1 week, or 1 month, or 1 year. He will ask you the duration of that. Every time swelling when occurs on our any part of the body, doctor will need to know what is the duration, whether it has happened suddenly or it has happened over the period of the time. And then doctor will ask you whether it is painful or not. He will ask you if it is hurting while you are having food, when you are swallowing or not. Any other swelling inside your mouth, if it is present, doctor will ask if you have noticed anything else. After asking the basic questions, doctor will ask you whether he can examine that. He will ask you to open your mouth. He will initially he will just inspect inside with a torch, and he will see if any similar swellings are present or not inside. So doctor will ask you if he can touch the swelling. When he touches, he will wear the gloves, clean it, and then he will touch that part and see what is the size of it, whether it is painful or not, whether it is moving, whether it is moving from that local area, is it moving or not, he will try to judge what is in content of it. Content means sometimes it might be blood, it might be the mucus, as we are discussing. So he will try to figure out what is inside that. He will try to check the other part of your mouth, if the similar swellings he can feel with his finger. Okay, so after this examination, mostly doctor will come to a diagnosis that it is a mucus cyst or a mucocele. What next thing doctor will advise you is, mostly investigations are not required for this, like sonography or X-ray. For mucus cyst, doctors won't advise all this investigations unless the swelling is very big in size. The doctor want to know what is content, what is inside it. Then only he might ask to do a local sonography or some investigation to do. So after the confirming that it is a mucus cyst, the treatment for it is excision, surgical excision. If the swelling is very small in size, doctor might ask you to do salt water gargle treatment. But if it is bigger in size and not decreasing, he will advise you to go for excision. So what you can expect whenever surgery is said, patient gets panicked that why surgery is required. So in this case, surgery is required because this swelling is not decreasing in size. It will keep on increasing. If you don't remove it, it will definitely keep on increasing, and it might disturb you while having food. It might further increase in size. So what surgery you can expect? It's a small surgery, not a major surgery. Mostly it is a daycare surgery, and it is done under local anesthesia. Like doctor will call you on a day of the surgery. He will perform the procedure in his procedure room, and he will ask you can go same day. Unless patient is panicked, or he don't want to take any local under local anesthesia, doctor will advise you go for general anesthesia. So general anesthesia means you have to get admitted. You need to go do the investigations before giving anesthesia, like ECG, X-ray, basic blood investigation. What I prefer is to do it under the local anesthesia. What you can expect is the doctor will ask you to come to the procedure room. He will explain you the procedure in the detail. We ask the patient to lie down. We clean the area with the saline or the water. Then we give some local injection, local anesthesia that is called, all around that area to make the lower lip numb for temporarily. Then we excise that swelling using the fine instruments, as the cyst is very small, and after excising it, we put absorbable sutures over there. They are the very fine absorbable sutures, so we need not remove the sutures. It will disappear by itself after few days. So that is how the surgery is performed. It will take hardly 10-15 minutes to perform the procedure, and post surgery, the numbness means because of the local injection, 4 hours you will not feel any pain. After the 4 hours, once the effect of the local anesthesia decreases, doctor will advise you to take some painkillers if you have any pain, the painkillers, and if required, only antibiotics will be prescribed. After the procedure is over, you will be totally awake during this procedure. So once the procedure is over, doctor will ask you to sit, and ask you to sit in waiting area for like half an hour to 1 hour to check for if post surgery any bleeding is there or any pain is there. He will ask you to have some cold water or even ice cream. Doctor will ask you to take. Why we ask to take the cold water or ice cream is post surgery, the swelling is expected in the area where we operate, like lower lip, the swelling will occur. That swelling will be significant, so doctor will ask you to take some cold water or to apply ice, so that swelling doesn't come. It will get controlled by applying the cold ice over there. He will advise you not to take the hot fluids like hot tea or hot coffee for maybe few days. Even the hot food he will not advise you to take on the day of surgery, and maybe next day also. He will advise you mostly take the normal temperature food and cold food, so that the swelling remains in a control. Once after 30 minutes or 1 hour, doctor will re-examine you whether there is any bleeding or any pain. If it is not there, he will advise you to go home. Usually no dressings are applied over that area, as the inner lip you can't put any dressing. So doctor will give you some prescriptions. What you can expect are antibiotics if required, some painkillers if you have pain, and doctor will advise you some gel or ointment to apply over there. So that is what simple treatment will be. Post surgery, after 5 days, he will call you back to just examine how the sutures are there, whether any swelling is there or any infection, any problem in that area. If it is not there, doctor may not ask you to come back, as the stitches will go by themselves. If the doctor has sent the swelling, that mucus cyst, for a biopsies to check under the microscope, then he will ask you to come back, or he will follow you up with the biopsy report. That is what you can expect. If patient is panic, he don't want to take it under local anesthesia, or if it is a small child where local anesthesia is difficult to give, or child will not be able to lie down comfortably, we advise to do it under general anesthesia, where in general anesthesia we need to admit the patient. Anesthesia doctor has to see you. Some investigations will be advised, like X-ray, chest X-ray, ECG, some basic blood investigations, and then anesthesia will check whether you are fit for surgery or not. This is also a daycare surgery, like morning we will call you, we will admit you, then the anesthesia will give you anesthesia. Under general anesthesia, patient will be lying down comfortably, so doctor will do the surgery. That also will take 10 to 15 minutes. Once the procedure is over, we will shift you to the recovery room, where the post-surgery patients are being examined for 1 hour, half an hour to 1 hour. Once patient is completely awake, patient is shifted back to the ward or the room. Patient is advised to not to have any food or water for at least for 4 hours post-surgery, post-general anesthesia. After 4 hours, you can take some water, after that some food, and once all is fine, doctor will ask you to go home. So like within 12 hours the procedure, if it is done on general anesthesia, you can expect around 12 hours time to be spent in the hospital. And follow-up will be same. After 5 days, doctor will call you back to just check the sutures, whether there are present any infection or any swelling is still persisting or not. And if you have sent a biopsy, then doctor will follow up you for that. So hope you understood what is mucus cyst or mucocele. Do not get panicked if the swelling is, if it is a mucus cyst. Try the home remedy first, what I advise. If it is not working, then you can meet a consultant or doctor in that field and get a treatment done. Thank you for listening me and watching our videos. Thank you very much.